undergoing fertility treatment is already a significant journey, and adding travel can make it even more complex. Whether you're coming from out of town or abroad, those sessions are designed to support you with particular tips, emotional guidance, and safety information to help you to feel more prepared and confident. My name is Irina MacArthur, and I'm Director of Patient Experience at Inception Fertility. I'm pleased to welcome Lisa Lucas, registered nurse at Reproductive Medicine Group in Florida. Lisa has worked closely with so many patients who travel for care and will be sharing key insights around clinical suggestions and selection, medication management, emotional wellness, and what to expect if you're in cycle while you're away from home. Please feel free to submit your questions in the chat box and we will address all the questions at the end of the session. With that, I will turn it over to Lisa to begin.
Hi, everybody. Thank you so much for joining us today. I'm Lisa, one of the nurses at the Reproductive Medicine Group. So today we'll be talking, just like Irina said, we'll be talking about traveling for fertility care and everything you need to know. So you may already be traveling for care or just thinking about it, but today's session is to give you clear guidelines on preparing for your journey. So we'll talk about practical logistics, emotional support, financial planning, and important considerations while you're traveling for treatment. So we'll go ahead and get started. And then like Irina said, we'll do a Q&A at the end for anything additional that you might be thinking about. So just as an overview, we are seeing more and more patients that are traveling for fertility care. Sometimes they're traveling for access to a clinic with higher success rates or a specific service that isn't available locally to them, such as like donor egg or needing a gestational carrier. Sometimes it's simply because you started treatment at one clinic, relocated, and then wanted to continue your fertility journey back with your original physician or clinic. So we do see a lot of patients that way. But today we'll talk through the key things to think about while navigating all of this: travel logistics, emotional well-being, financial planning, and in-cycle travel guidance. So next slide, please. So when it comes to choosing a distant fertility clinic, if you know that you are going to need to travel for care, there are some key things to look for when choosing a clinic. So to start, some insurances have clinics that are centers of excellence. So you may want to start there. It's a good idea to speak with your insurance about this. So you can also compare clinic success rates and patient reviews. You can use websites like the CDC and SART. They are helpful for comparing statistics. You will want to choose a clinic that has experience with out-of-town monitoring patients. This way, they're familiar with receiving orders from the distant clinics and then providing results to them in a timely manner. And finally, you'll want to make sure that you understand any legal differences in treatment between your home state and where you're going, whether that's just to another state or whether you're planning to travel internationally. Next slide. So travel and lodging logistics, you'll want to start planning your lodging early. And if you're flying, definitely want to book refundable flights. So it's important to stay flexible. Often during fertility treatment, calendars are not set in stone. Timelines shift a lot. Be sure to stay somewhere close to your clinic, especially during your stimulation or retrieval phase. You'll have a lot of appointments during this stage of treatment. And then some patients like to bring a travel buddy with them. This could be your partner, a friend, or family member. We've seen a lot of patients, of course, do it on their own. Not everybody has the option to bring somebody with them. It can be done, but it can definitely make a big difference emotionally, practically, to have someone with you. And then also to add, if you're having a procedure done in a surgery center, such as an egg retrieval, you are likely going to need to have a known driver with you. That's usually a requirement from the surgery center itself. Next slide, please. So just some financial planning tips. Travel can add obviously a lot of extra costs to all of this, so it's a good idea to create a budget that includes transportation, lodging, meals, time off work. You'll want to take all of those things into account. So talk to your clinic's financial team about what's covered, ask if there's any travel grants or programs available. You'll want to talk to both clinics. You can talk to your home clinic and then also talk to your monitoring clinic that you're traveling to for treatment. But if you do have insurance coverage, you can also check with them and make sure that they'll cover appointments at more than one clinic as well. A lot of the costs when you're doing out of town monitoring, a lot of those costs do tend to be out of pocket costs. But you could, like I said, you could always check with your insurance to see if they would cover additional appointments. So, and then some people use flexible savings accounts or different financing options that might be offered with by your clinic. So just ask lots of questions to the financial teams. They're usually pretty helpful with what options you might have. Next slide, please. So some medication management. This is obviously pretty important when you're traveling. So with your medications, you want to keep everything in their original containers or bottles when you're traveling. And then if you're flying, definitely store them in your personal carry-on items. Don't check your medications. They can be lost or damaged that way, so not in your checked luggage. You'll want to pack extra doses in case you run into travel delays, and double check that you have a cooler or cold pack for medications that require refrigeration. You'll want to set reminders and alarms as well, especially if you're switching time zones. If anything gets confusing when you're changing time zones, you can always check with your treatment team. They usually can help you tweak your schedule if needed, if anything gets off, your timing gets off or anything like that. They're usually pretty good at helping out with that. The next slide. And then there's some legal and documentation essentials as well. You might need some extra paperwork or documents in your phone. For example, you might need your consent forms or legal documentation if you are doing third-party reproduction, which would be like gestational surrogacy. And so it's a good idea to just have copies of everything or screenshots on your phone. You may want to have your treatment plan summary as well, medication list, contact info for your home clinic is all good. They can be essential if you need urgent care while you're away. So you also, when you're traveling to a clinic for out of town monitoring, you'll want to have a copy of your actual orders that came from your home clinic. They're usually sent from your home clinic to your monitoring clinic, but it's always a good idea to have a copy of it because in case it doesn't get to where it needs to be and you're at the clinic the morning of an appointment, they might ask you for your order. So always ask your home clinic to give you like a copy of it. You can just have a screenshot usually, and wherever you're monitoring, they can sometimes let you email it to them if need be, if they didn't receive it from your home clinic. And like I said, you can have like paper copies. Most people just prefer to have screenshots of these when they're traveling. Of course, like the obvious insurance card, emergency contacts, that type of thing is always good to have in hand as well. The next slide. So we can talk a little bit as well about emotional and psychological well-being. It's definitely a huge component of fertility treatment already. So when we add in the component of traveling for treatment, it gets quite a bit harder. It's definitely being away from home during such an emotional time can be really, really tough. So definitely make it a priority to take care of your mental health. Stay connected with your support system that's back home. If you're traveling somewhere new, exploring that new city can be something to help you stay busy, if that's something that helps, to kind of take your mind off of things and keep your mind busy. Or you might want to prioritize rest and downtime if that's something that helps you feel regulated. Whatever works best for you to kind of keep everything calm. Next slide. So, partner and companion support. If you're traveling with a partner or a companion, it's helpful to talk about how you'll support each other. As an example, one person can keep track of appointments and medications, while the other person can handle meals and transportation. Just an example, but it's especially helpful to share the mental load with somebody. It can be quite high during this time. You can learn how to give the injections together. It can make it a little bit less intimidating, and always celebrate the small wins. It's easy to get wrapped up in what comes next on your fertility journey, but leaning into the now can really help you support each other. Next slide. So then in cycle travel, general precautions. This is an important slide with precautions that are pretty specific to IVF. Your care team will likely advise you not to travel once you're a few days into your IVF cycle and until a certain point following your egg retrieval. You'll be needed for frequent monitoring appointments, and timing of these appointments is critical. It's also important to be flexible here, as changes in your body's response can shift timelines that can change your travel plan. If you are planning for an embryo transfer, you'll want to check with your clinic on their guidelines on when you can travel back home. Usually it's advised to rest for a day or so, so just keep that in mind when you're booking flights. And of course, remember to book those re-bookable flights as well, just in case your plans change. And then next slide. So medical emergencies while traveling, of course, we hope none of this, is anything that anybody has to deal with, but of course, we always want to be prepared. It's always good to know what to look out for if you run into complications during or after your treatment cycle. This slide talks a little bit about OHSS. It's one of the more serious complications that can occur from IVF. It is uncommon for this to occur, but it's good to know what to look out for just in case. Once again, you should know where the nearest local hospital is to you in case that's needed. If you do need to be seen at a hospital or urgent care, you'll want to let them know that you're undergoing fertility treatment. Since most ERs aren't familiar with these types of complications, it's good to just give them a heads up if possible. And then always keep your treatment team in the loop as well, alerting them that you needed to be seen at a local ER or urgent care facility. You can always check in with them prior to being seen so they can help you assess any symptoms that you might be having. But of course, if it's an emergency, you need to be seen right away and then communicate with your treatment team later and let them know. So next slide. And then just some key takeaways, basically to wrap everything up. Some of the most important takeaways are to plan ahead and stay in close communication with your care team. Be cautious about when you travel in your cycle. Always ask if you're unsure when you should and should not be traveling. Just talk to them. Bring extra medications, know how to store them, and stay on schedule. Take care of your emotional health. Have a backup plan in regard to traveling. Try to stay flexible, as fertility treatments don't always go according to plan. And remember, it's okay to ask questions. Being informed will help you feel empowered throughout this process. Next slide.
Wonderful. Well, Lisa, we just covered so much information, and we started receiving questions already. And it's great that we have so much time left to answer all the questions that I'm receiving currently and support patients throughout their journey, and especially when they're traveling for those treatments. So I'll be addressing a few questions as we go, and I encourage everyone to submit your comments in the chat box, please. So the first questions that we have for the general travel slide, does this go for the IUI as well?
It depends if you're taking injectable medications for the IUI. Most commonly, patients are not on any injectable medications. You may have like one injection known as a trigger injection. So typically traveling is okay during an IUI cycle. Of course, check with your treatment team because you wouldn't want to travel if you're doing a cycle where they're monitoring you frequently and bringing you in for ultrasounds. You don't want to travel during that time because you'll be needed for appointments. But in general, there's not as many risks associated with traveling during IUI.
Excellent, thank you. Our next question is, how should we plan for shipping biological materials such as embryo or eggs across the state lines or internationally?
You definitely want to start off first with checking with your own treatment team. A lot of clinics, they have their own, like, they may have their own transport, like company and team that they use to help you coordinate all of that transport. Our clinics in the Prelude network, we do have that. So they would help you coordinate all of that. But if you're not at one of our clinics, just check with them. They probably have companies. There's usually like, a handful of them that they'll give you the contact information. Normally, the process for that would be you contact them, set up an account with them, let them know what type of tissue that you're transporting. And then once that's set up, usually that transport company will communicate directly with the clinic to coordinate shipment on the tissue.
But those shipment might be coming at extra cost that not included in the treatment. Am I understanding that correct?
That is true, yes.
And is it true that you have to check with your own clinic and with the receiving clinics all the details before you start the process?
Yeah, you definitely want to communicate with both clinics. You'll want to, first discuss it with your doctor. They'll likely communicate with the embryology team once you've been given like a green light on shipment, which the treatment team, would give you as long as all is good. Then you would start that process with communicating with the transport team or the company, the third party shipping company that would assist you with the shipment.
So thank you for clarifying this, Lisa. So the next question is it okay to fly a couple of weeks following an embryo transfer?
Normally, that's fine. It's always a good idea to check with the team. It will depend on how many weeks, I should say. Usually, after an embryo transfer, you'll have a pregnancy test about 8 to 10 days later, just depending on your protocol. And then after that, you'll have an ultrasound, they'll repeat your pregnancy test a few times, and then you'll have your ultrasound a few weeks after that. Once all is good with that ultrasound, you're usually pretty good to travel. It would just depend if your treatment team would allow you to travel before you've had that ultrasound. It would just kind of be a case by case basis, depends on like your risk factors, and where you're traveling, how far, that type of thing. There's some risks associated with traveling if you're on medications, and then if you've not had like a proven ultrasound to see that the embryo has implanted in the correct location. So just there's a lot of kind of factors to weigh in. So you would just want to check with the treatment team and they would be able to let you know.
Excellent. Thank you very much. Our next question is, can you carry backpack because you can't lift after embryo transfer? With the weight management, when you're traveling abroad, the question is about, would it be okay to carry a backpack because the carry-on is hard to leave the plane?
Yeah, that should be fine. Usually they don't want you lifting over 10 to 20 pounds. It's pretty hard to get a backpack over that weight. So I think most likely, unless you get it really, really heavy over 20 pounds, that would probably be no, like you wouldn't want to carry like a carry-on suitcase that had straps on your back, but a regular backpack standard size should be fine. No issue with that.
Okay, thank you very much. The next question is, how many days after IUI is it safe to travel?
I would check with your treatment team on that as well. They may recommend resting for a day or so afterwards. It's not a very invasive procedure, and it doesn't usually cause any pain or bleeding or complications afterwards. So they would most likely allow you to travel the next day, but you would just want to double check with the team as
Yeah. What are the times and cycles that you cannot travel at all? And how long is there between egg retrieval and transfer?
egg retrieval and transfer. Okay. You don't want to be traveling um, while you're monitoring so my specific clinic, the reproductive medicine group, we don't allow any travel once you begin your injections. So we would want you stationary from the point that you go on injections till you've had your egg retrieval and you're feeling good and can go home. So usually it's about 2 weeks that you can't travel. But also it will depend on how far you're going. So, you may be able to speak with the treatment team to see if you would be able to travel home a little bit sooner after the egg retrieval, like perhaps a few days instead of a week or two, just depending, as long as the risk factors are low and you're feeling well. But you would definitely need permission from your treatment team to do that. Um, and then you're likely to need a lot of monitoring appointments during an IVF cycle, usually beginning somewhere around day 5 of your injections, all the way through the trigger shot, which trigger shot can be somewhere around somewhere between day 9 and day 15, just depending on your response to medications. So you wouldn't want to be traveling in between that period. And then the second part to your question, how long between egg retrieval and transfer, correct?
Correct.
That would definitely depend on the treatment plan that you have. If you are planning on freezing your embryos and then doing a frozen embryo transfer, which is usually the most common treatment plan now, you would likely have a couple of months in between your egg retrieval and your transfer. But it would also kind of depend on the protocol that your physician has chosen for you. Lots of different factors can affect that timeline. In general, I tell most of our patients no sooner than about 2 months in between.
Okay, excellent, thank you. What is the max distance or time of flight or duration that should not be exceeded? Any
The maximum
particular,
amount of time. Say that one more time, sorry.
right? I think the question is, what is the maximum amount of time you should be, sitting in a plane or traveling? How far away can you travel? I guess that was the question.
I don't know that there's really quite a criteria for that. If I would say the longer your flight is, the longer you should wait after your egg retrieval to be on the safe side. But I don't know that there's, a definitive, oh, you can't be on an airplane for more than 6 hours or anything like that. But you could definitely talk with your team as well, say, I've got a 6 hour flight. How long do I need to wait? And they can help you out with that distinct answer.
Thank you, Liz. The next question is, can you please clarify what OHSS stands for?
OHSS is ovarian hyperstimulation syndrome. So it's a rare complication from IVF. It doesn't happen a lot now, but it's the risk is always there, and it's when your estrogen level gets very high and the ovaries had a lot of follicles. There's a lot of fluid that fills back up into those ovaries. It can cause some systemic effects in your body. And so we always are kind of on high alert for that just because it can be serious. But like I said, it is uncommon.
Okay, thank you. I believe our next question coming from Canada. I will need to relocate to different province at some point after embryo transfer. There's no certain timeline planned yet. It might be a couple of weeks or 1 or 2 months after the transfer. In case of pregnancy, when is it safe to take air flight and when is definitely not recommended?
The safest answer is going to be after you've had an ultrasound that confirms the heartbeat of the embryo, and obviously to confirm as well that the embryo is implanted in the uterus. That's what that initial ultrasound is for. So once you've gotten to that point, usually they would say that you can travel, but if you want to be, extra cautious, you can wait until you're out of the first trimester as well, because then the chances of miscarriage after the first trimester are much lower.
Excellent, thank you. Are there risks for shipping embryos or other states or clinics? Or is it recommended to travel for the transfer where your embryos are?
That's a really good question. A lot of people probably have that dilemma if they've relocated, they created embryos in one location. There is risk associated with transporting embryos. I couldn't give you any like number statistic wise on survival, but it's a low risk. We see good results most of the time at our clinic with transport, but I've also seen negative results as well. But yeah, the risk is there. If possible, if you can have your transfer where your embryos were created, if that's possible for you, then I would think that that would be the safest option, but obviously that's not going to be possible for everybody.
Thank you. Our next question is, what should I do if I miss my medication when flying back due to the time difference? Will sitting down for hours in the airplane affect embryo transfer?
You'll have to be extra cautious with your time schedule, just knowing that you're crossing over time zones to keep the amount of time in between your injections like as stable as possible. So if you know you need to give your injection every 24 hours because you do it at 6 p.m. every night, so that would be once every 24 hours, then you'll need to make that adjustment. They do have like some apps for that if that's helpful for you, or just sitting down before you're doing the traveling and figuring out the time that you do need to actually give your injection and then setting alarms on your phones. That's going to be like the best way to make sure that you don't miss injections. Obviously, it's not preferred, but you very well may need to do an injection on an airplane if you're traveling, because it's due to happen. So you just want to take all the precautions and cleanliness and everything if you need to do that. And then what was the second portion of the question?
Okay. I'll have to find the second part. No, that's totally fine. We'll get back to this if that's okay. But the next question is, can you just clarify if transferring egg or any specimen from one city to another or from one clinic to another generally affecting the quality of the specimen?
It doesn't change the quality of the specimen being transported, but there's just risk associated with moving the sample from the tank where it's being stored to then a travel tank and then moving it again to where it's being relocated. So there's risk associated with that, but it wouldn't actually change the quality. It doesn't, change the fact that if you have a excellent quality embryo, it wouldn't lower the quality of the embryo. Eggs transporting eggs or moving eggs, it's a little bit riskier than embryos, moving those.
Thank you. Is there any particular reason why it's more risky?
Eggs or oocytes, they are just more delicate, and so they are more difficult to freeze and thaw as opposed to embryos, because an egg is one cell and an embryo is many, many, many cells. So it's more stable. So it's probably a little bit safer to transport embryos versus eggs.
Excellent. Thank you very much for clarifying this, Lisa. And I found the second part of the question that you answered previously. Will sitting down for hours in the airplane affect embryo transfer?
That shouldn't affect your chances of the embryo transfer being successful. If you are on medication, if you're doing a medicated cycle for frozen embryo transfer, there are risks associated with traveling because you are sitting for a long period of time. So like you've probably heard, separate from any IVF or fertility treatment, that there's a risk of blood clots when you sit for a long time on an airplane. And so that risk is further compounded when you're taking fertility medications, usually in the form of estrogen for a embryo transfer. That can further your risk of that. So your treatment team, you let them know that you're traveling. They would likely give you some precautions to take if you're taking a long flight. They can kind of give you some different tips and tricks to help lower that risk, but it is there, the risk is there, but it shouldn't lower your actual chances of success or anything like that.
Well, thank you. Shifting the gears here a little bit, and I have a question about exercise. So, is it safe to do exercise and yoga after IUI procedure?
Normally, yeah, it would be okay to do yoga after an IUI.
Perfect. Any other exercises that you would recommend to avoid after IUI or IVF, perhaps?
For IUI, that's probably pretty clinic specific on if they tell you to do more rest versus if you can continue your normal exercise routine. So would check with them. But yoga after an IUI shouldn't be an issue. For IVF, there are a lot more exercise restrictions. Once you get started on injections, usually your clinical team will have you stop exercising. You're allowed to walk, but we don't want you or doing yoga really. Anything that requires lifting, bending, pushing, pulling, anything of that sort is usually a big no for IVF and for 2 weeks following your egg retrieval, because we want those ovaries to get back to their normal size before we have you start exercising again.
Thank you, Lisa. Our next question is, are you able to get OHSS from letrozole? I had over 17 follicles in one ovary and my IUI was canceled.
I don't know for sure. That's a question that is pretty unusual. So I'm sorry that that happened to you. That would probably be I don't know if this is something that just happened recently to you, or, if you're already a week or more out from that scenario, then likely no, you're not going to have any, ill effects from that. You would just ovulate and, wait until your cycles start occurring again if you do have regular cycles. But normally letrozole is not something that can cause OHSS.
What are the specific risks that associated with flying after embryo transfer? I think you touched based on fuel already, but there's a question, if there's
Yeah, mainly what we addressed a couple questions ago, where if you're on medications, so if you're taking estrogen, some people do frozen embryo transfer cycles without medications. But if you are taking medications, and usually that's in the form of estrogen, we're raising your estrogen level and then flying. So we're giving you two risk factors of possibly have a risk of blood clots. So that's probably the main risky part about flying. Also, if you were to fly during the in between, you find out you're pregnant and you haven't yet had an ultrasound. So we don't know yet if that pregnancy is in the correct location. You could have, you typically don't want to be on an airplane if, all of a sudden you could start bleeding, or, there could be a loss that takes place, or the biggest thing is if we haven't had an ultrasound done and we don't know that the pregnancy is in the correct location in the uterus, there's a risk of ectopic pregnancy. And so, and an ectopic pregnancy is an emergency. You need to be seen in the hospital right away. So you wouldn't really want to be on an airplane during that time. But other than that, those are the main issues with flying.
Thank you, Lisa. Will the monitoring clinic readily share monitoring data with the other clinics, and how does correspondence and communication is structured and generally? Or do patients normally need to manage this communication closely to ensure nothing is missed?
Once it comes to obtaining results, usually the clinics communicate with each other. Sometimes you'll have a clinic that will give the patient the results, but if they do that, they should still be providing them to the ordering clinic. And then in addition to that, as far as the patient managing portion, usually the patient is required to make their own appointments. So usually your team would let you know, hey, you need to have an appointment for this on this day, a blood work and an ultrasound on this day. Go ahead and schedule your appointment. We will send orders. So then the clinic will send the orders directly to the clinic. You schedule your appointment. And then once that appointment has taken place, the clinic that did your appointment, did your blood work and ultrasound, they would send the results back to the ordering clinic.
Excellent, thank you. We talked about a little bit on frozen embryo transfer, but can you please provide a little bit of an overview on, the time frame between retrieval procedure and fresh embryo transfer?
Okay. A fresh embryo transfer. So basically you go through the stimulation portion to grow your eggs with medication. You take a trigger shot and then have your egg retrieval. Following your egg retrieval, this would be considered day 0, your egg retrieval. Normally a fresh transfer takes place on day 5. So your egg retrieval is day 0, the next day is day 1, next day is day 2, and so on up until day 5. So your embryos would grow in the incubator for those 5 days, and then you would have the egg retrieval on day 5. It's also referred to as a day 5 transfer, fresh transfer, aka day 5 transfer. So normally just 5 days in between the retrieval and the transfer day.
Okay. I'm not sure if you can answer the next question, but are there any certain countries that have better or worse reputations for donor eggs?
Unfortunately, I don't know the answer to that, but maybe Irina and I can look into those statistics later on and get back to you on that question.
Yeah, I think we do have in North America ASRM, and in Canada, I'm not sure. I forgot actually the website for Canada. I know for US it's ASRM, where you most probably can find information about the donor egg. What are
Probably
the
SART.
SART?
SART, the Society of Advanced Reproductive Technology. That's usually where you're going to find the most detailed statistics.
Thank you. If doing a fresh embryo transfer, how soon after egg retrieval can egg transfer be done, hoping not to stay abroad for 1 month?
Um, so if you're doing that fresh transfer, you're not planning on freezing your embryos and transferring later, then the transfer just takes place 5 days after the retrieval. And then you would just want to check with your team on how soon they would allow you to travel back home after your transfer.
Is there any food that you not recommend to take or consume during the IVF cycle?
There's really not many foods that are off limits. We do typically tell our patients to treat yourself as pregnant. So that more kind of goes toward um, vitamins and supplements, taking your prenatal vitamins, avoiding anything that your team has probably provided you, like a medication list of approved medications. You want to avoid anything that's not on there. There's caffeine restrictions. So that one's pretty important and pretty common that people bring up. Once you're pregnant, they will want you to have just 1 cup of coffee a day. And so we have you treat yourself as pregnant during the IVF portions as well. So that is standard as well. But other than that, there really aren't any foods that are off limits.
The next question is overall, are there air flights harmful for a baby when you're pregnant? And if yes, why?
No, I don't think that there's really studies that are showing that any airplane travel is harmful for a pregnancy.
Okay, so how long does it take from the first injection to the positive pregnancy test, considering a PGT in the process?
Considering PGT. Okay, so if you've had PGT tested embryos, that would mean that you're doing a frozen embryo transfer. So usually minimum amount of time from the first injection to transfer would be about 2.5 weeks or so. Kind of just depends on exactly. There's when you're on medications for frozen embryo transfer, there's a you can manipulate the cycles quite a bit. So kind of just depend on the protocol that your clinic follows or protocols that your clinics follow. But yeah, I would say minimum about 2.5 weeks, but they can go up to even 30 days or so, just depending on your results. And like we talked about in the presentation, not everything goes according to plan. And so calendars can change as your results come back, and they may not be exactly what was expected.
Thank you. Are they, staying on topic of PGT for a little bit, are there any scenarios where we don't have to do PGT testing on embryos before transfer?
That's a question definitely specific for you and your physician to discuss. They would definitely want, they should be able to advise you on for your specific situation if PGT is advised or recommended, or if you can move forward without it.
Oh, thank you.
Mhm.
Our next question is, do we have to take any specific precautions during the whole process in case of endometriosis, for instance?
I don't, there's not really any specific precautions to endometriosis. It would be all of the general precautions related to IVF, but nothing specific if your diagnosis is endometriosis.
Yeah. And another confirmation and maybe reassurance that is required, just to confirm, traveling for 1.5 hours via car is okay from your home to the clinic.
Yeah, that's pretty common. We have a lot of patients that travel that distance or more to our clinic, and yeah, we wouldn't say that you can't make that drive following procedures and such. You should be okay with that.
Thank you. And another question, you touched base on this early, but I see that there is maybe a reassurance required. In between egg retrieval and frozen embryo transfer, do you have any recommendation or advisories on limit travel or exercise, or you're pretty much business as usual until the embryo transfer period starts?
Business as usual is a great way to put it, actually. So once you get out of that window from your egg retrieval, for whatever your clinic requires, your restrictions to stay in place. So we have our patients wait 2 weeks after their egg retrieval before they can start exercising and traveling again. But after that, that's when your business as usual starts up. It's a great time to travel if you're trying to get something in. And you can definitely go back to your exercise routine as well up until you start your frozen embryo transfer process. And usually you've got a couple of months in there to get all of that done.
Perfect. Can you please touch base on if there's like some must pack items that patients often forget, but end up needing?
Um, that's a good question. Those cold packs are often forgotten. Um, so that's definitely an important one, even if just traveling short periods or short distances, people sometimes, if they have to bring their meds with them, you should bring them in a lunchbox with a cold pack. When you're traveling with your medications, it could be easy to forget like syringes or needles that you might need. Um, but those can usually get picked up somewhere locally at a pharmacy. So I've seen that happen before. Um, And then something else with like when you're traveling with your medications, people don't realize is that overhead compartment on the airplane gets really cold. So that's why we want you to keep your meds with you in a personal item, like underneath the seat in front of you, instead of putting them up ahead so that your meds don't freeze up there in case it gets like really, really cold. But other than that, I can't think of anything specific that people generally forget.
Yeah. I know we're in the subject of traveling during your cycles or for your cycles, but there is a question if you can, briefly explain the process of IVF, what it's entail, and is there any chances of getting twins with the treatment?
Twins. Um, so the process of IVF, obviously, it varies quite a bit depending on your treatment plan with the doctor, but you'll take injections for approximately 9 to 15 days. The injections are to grow your follicles and eggs on your ovaries. Then typically you have a trigger injection somewhere in that 9 to 15-day window, and then you have your egg retrieval. And that's about 36 hours following that trigger injection. So at that point, the eggs are taken, and then they would be combined with sperm in your embryology lab. After that, those eggs will stay in the incubator and ideally continue to grow and divide to become blastocysts, which is typically the stage of embryo development that they want to freeze the embryo in. So some patients have an embryo transfer right then. That's kind of what we were referring to when we were talking about a fresh transfer or a day 5 transfer. Other patients have their embryos frozen at that point, and some people have them sampled for PGT testing, which is genetic testing on the embryos. And then if you do have genetic testing, the embryo has to be frozen, and then you would have to have a frozen embryo transfer later. So that's kind of in a nutshell the IVF process. And then unfortunately, part 2 of that question just escaped me as well.
The question was about IVF overall, and if there is a possibility of having twins
Oh,
in IVF process.
um, so twins there's a risk of having twins if your physician transfers one embryo and that embryo splits, that is uncommon, but it can happen, and that can result in twins or multiple pregnancy. Or this is less common, but sometimes physicians may transfer more than one embryo for different reasons. That would definitely be a discussion to take place with your physician, but that transfer could also result in a multiple pregnancy.
Always a possibility. Even with one transfer, right? The embryo can split
Yeah.
into two. All right, excellent. So if I have a state IVF insurance coverage, but not out of state, but have to travel for my transfer, is there a way to use your insurance for outside monitoring? I understand I would need to pay out of pocket for actual transfer at the clinics.
You probably would definitely want to talk with your insurance about those details. I don't know for sure. It sounds to me like the best option for you would probably be to do your monitoring local to you so you can use your insurance. Um, and then you would travel to the other state to actually have your transfer, and then pay the portion that's required for that transfer process. That would probably make the most sense so that you could use your insurance benefits as much as possible.
As well to mention, within our clinics in the Prelude network, we do have financial counselors available for each patient. So those questions can be clarified and they can provide you a little bit more detailed information on reauthorizations and coverage, etc. That might be helpful.
Yeah.
Excellent. The next question is, and we still have a lot of questions, but only 9 minutes left. What, if any, are there any, basically, if there are any downsides of having frozen embryo transfer and, in comparison to fresh?
Um, I think it's most common actually nowadays for most people to do frozen embryo transfers as opposed to fresh transfers. We do them very infrequently, the fresh ones at our clinic. And I think that's probably most common. I don't think that there's a downside other than time, that it does take longer to have your embryo transfer once it's frozen. But some people do, or most people prefer, or if your physician has recommended PGT for you, you have to have a frozen embryo transfer. And that's usually where the frozen embryo transfer comes from. It's because the patient is doing genetic testing or PGT testing on their embryos. So in general, there's not really a downside to doing a frozen transfer.
Another question about PGT. I know it's a hot topic, but can you do, partially fresh transfer with some of the embryos that was retrieved and freeze the rest of them for PGT testing in the future?
Usually you can do that. I think some clinics will not allow you to PGT the remaining embryos that didn't get transferred. But I think in general, most clinics do allow that.
So basically the advice is please consult with your physicians. They will
Yeah, so much is
understand.
case by case. So you
Right.
definitely want to talk to your doctor about what you want to do, and what you're asking about. But our clinic does allow that process to happen.
Yes, I'm not sure if you know this question, but let's see. Is there any barriers to fly with medication, such as TSA regulations for carrying syringes, needles, etc., like sharp objects? Um,
If you have a prescription for that medication and or you ask your team to write you a letter, which is very simple as to like it's just letterhead from your physician that you're carrying medications for medical treatment. As long as you have that type of documentation and or the prescription, it shouldn't be a problem getting through TSA.
Thank you. The next question is, during IVF fresh transfer, how often the sperm specimen sample is needed?
How often is the sample needed?
Mhm.
It should just be the one time for the day that you have your egg retrieval, they would need the sperm sample to allow the eggs to fertilize.
So one time only. Our next question, due to the business of travel, I accidentally missed a dose of estrons following a recent frozen embryo transfer. Does missing one dose of medication overly matter?
I mean, in general, we want you to, stay as close to possible as your schedule, so that your levels stay as steady as possible. But accidents happen, and normally the answer to that question is no. If you miss a dose, um, and it's taken somewhat soon after you realize you've missed the dose, um, it shouldn't have too much of a negative effect, but it also might depend on like what type of estrogen you're taking.
Thank you. Is there any precautions on traveling after IVF if I'm using HRT and thyroid medication?
Not any more than the average fertility patient, I don't believe.
Okay, thank you. And we have time for our last question. Lisa, I know you've been such a rock star answering all those questions, and I hope it was helpful for patients. But what is the one thing you wish all traveling patients knew before starting their journey?
Ooh. Um, I think definitely planning for the unexpected.
Right.
So much can change during your treatment. And if you're traveling, you just have to be flexible. It's going to be extremely difficult if you're trying to be very rigid with your plans, with getting here and then getting there and going back and forth. You just got to realize that not everything's going to go according to plan. And you've got to figure out a way that flexibility is going to work um, as best as possible. It's difficult, that's for sure, but it's really the only way to get through it is to just have that mindset, knowing that things may change and not go according to plan.
Thank you, Lisa. We covered a lot of helpful information today. Thank you very much for your time. But I would like to mention as well that we conduct our webinars twice a month. One webinar is usually focused on emotional support for our patients, and the second webinar is usually covering some medical terms. Your clinics broadly advertising the calendars for the remaining of the quarters. Usually we coming up with the topics on a quarterly basis. We do have recordings for all the webinars as well. So if you register for those webinars, you will get a recording even if you not able to attend it live. Lisa is based in Reproductive Medicine Group Clinics, which is located in Florida. Any particular location, Lisa? Where are you?
Tampa.
Tampa,
Tampa, Florida.
Florida. And if you're not yet patient, we do have 90 plus clinics in the network. You're welcome to scan the QR code, which I just broadcasting right now, and book your consultation. We'll give you a peace of mind to ask the questions from the physician directly and get your answers. Thank you very much, everyone, for joining us today. Wishing you very pleasant evening.
Thank you, everybody.
Goodbye.